Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, we have nitrates and the angina. Right. These nitrates which are seen, the nitrates will actually, okay, okay. These nitrates will cause systemic vasodilatation. Number one, they cause a systemic venodilatation. And because they cause systemic vasodilatation, they will lower the preload on the heart, and obviously the load on the heart is decreased. So as a result, they will decrease. This will lead to the decrease in left ventricular and diastolic volume is also decreased. Okay, this will also cause or reduce the wall stress, and this will also reduce the wall stress, and they will also reduce the myocardial oxygen demand is also reduced. So because of this, the nitrate, which is nitroglycerin, is actually the first line agent. And this nitroglycerin is the first line agent, and it will provide the rapid relief in symptom. It will cause rapid relief of symptoms in angina pectoris.
thank you and thank you for watching.